Hi, welcome back to Facebook Live. I'm Dr. Annette Mercatante from the Clair County Health Department, and we're here now once a month to answer your questions. So please put your questions into the chat box or whatever it's called, and we'll try and get to them. So we're going to start out today, as we always do, with just an update on cases and the data surveillance that we have. The total number of cases is over 18,000. This is total cumulative from the onset of the pandemic in March of 2020. We've had also a total of 779 hospitalizations, 425 deaths, and the recovered is obviously catching up now because we're getting back to being able to take those cases out of our queue. So currently in the past week, we've had about 7 new cases, or an average about one new case a day, with the case positivity rate now dipping below 1%, which is the best we've had, I believe, pretty much since March of 2020. So this is really good news. Next slide. We can show this graph with a certain sigh of relief. I remember I was talking before that I was worried that we'd plateau at a higher level, and we have not. We've come down very nicely. And I would safely say we are in a recovery phase of this COVID surge. Now, recovery means that we are getting better. It doesn't mean that relapses can't occur and changes can't occur with our overall outcomes, but we're in pretty good shape right now. And the next slide is our vaccination rates. Vaccinations have, like everywhere else in the country, kind of taken a little dip down. We're still vaccinating. Vaccinations are still available here at the health department by appointment. We wouldn't turn you away if you showed up and even asked for a vaccine. And we're also continuing to work with community partners for pop-up vaccine clinics throughout the summer. So take a look around. If you're at an event, good chance you're going to find us there. And this is a map that doesn't show up really super well, but green is good. So as we are also noting, rural and minority populations and more populations that have a lower socioeconomic status, our poorer communities, are more poorly vaccinated. It means they are more vulnerable to the virus if and when it starts to circulate again. And you can see that our green areas are pretty much clustered around Fort Gratiot down through the urban centers, with the exception of the urban centers that are poor, right? The South Side and some of these areas that have traditionally lesser incomes. So we still have a lot of work to do to try and stabilize that playing field so that if there is more virus transmission, it's not going to disproportionately hit people in certain areas, which is most likely what we're going to see throughout the country. We have wide variations in vaccination rates, and those that have good vaccination rates are probably going to avoid large scale transmissions, and those with poor vaccination rates are more than likely going to have the lion's share of the burden of the infections of the diseases. So this is our dashboard. And as usual, our dashboard is updated regularly so you can see where we're at. I do want to tell you that we are transitioning on our social media and data updates from a Monday through Friday to a Tuesday and Thursday. The cases just aren't coming in that fast and furious. Cases can get put on and taken off. And when you only have one or two cases, that can be very confusing to people when numbers go up and down by a couple digits. So we're going to do twice weekly. There will still be a weekly report on Fridays that will be distributed, and there will still be daily updates on our dashboard on our website. So this change will help align us more consistently with the way the state collects all their numbers from onset dates versus referral dates, et cetera, et cetera. There's lots of complexity to data collection. And so this will give us a chance to kind of realign and be consistent with that. So uh, don't freak out if you don't see something every day from us, but the numbers aren't changing. And we can always go back to daily reporting on social media feeds if our rates go back up. So the other announcement I do want to make is non-COVID, but we are, yay, we
Yay.
are going to be starting our next round of what we call a community health needs assessment. This is data collection that tells us the overall health of the community, and it addresses everything from uh, behaviors to chronic disease and access to health care. And this current round of data collection will also include COVID impact. So, what was the impact from COVID on your life, as well as some data collected on trauma. So, I'm really excited about this. There will be um, part of the survey is a large phone survey that will be starting in July, I believe July 12th. Yes, July 12th. And this is contracted out through a professional agency that does these kinds of things. So you'll potentially get a phone call. We're hoping to reach well over 1,000 people with this data collection. The phone call will come in as an outside number, probably as, did you put this down?
I know
What the
that'll be
area
in the
code
news
is?
release.
Okay.
It's going to be in the news
So
release on next Tuesday.
but the point is, if you get a phone call from somebody that's asking you to take a survey on behalf of the St. Clair County Health Department, that is in fact legitimate, and we are encouraging people to answer those calls and get that information. Remember, that information will not be connected to you. Then all that information will be put together at what we call aggregate, so it'll be anonymous and it'll report it out in an anonymous fashion. So none of it will be tracked back to you individually or to your household. So, press release will be coming out for that. All right, let's get to your
Yeah.
questions.
Okay.
First question I got. Oh, you're gonna read them? Sorry.
Yep.
Go for it,
No
Annette.
problem. These came in over the last day or so. Are there any cases of the Delta variant in our county?
Not yet, but don't be surprised, right? Just like the other variant, it starts out and it doubles exponentially. So right now, it looks like the Delta variant is kind of doubling every couple weeks. That might accelerate. We currently have 52 cases in the state, distributed through 15 counties. And when they detect one in our county, they'll send us notification, and we'll probably go ahead and put a press release out to let people know, yeah, it's here. But it could be here already. We just haven't detected it. So this is, one of the reasons why we want people to continue to to behave as though the virus is still present in our community, because it is. Right? We're not getting zero cases. We're getting 1 to 2 cases every day. So we do want people to remain cautious with that.
Doc, can you explain to people why it is a variant of concern?
So we label variants based on the impact they may have on our well being. So, variants of concern are mutations in the coronavirus, the COVID-19 virus, that either impacts the ability to infect us, or some amount of severity of illness, or the impact of perhaps the medications that we have. We've already had to switch the monoclonal antibody combination to something else because of variants, not because of the Delta one, but because of other variants increasing in number, and those products not working as well. The Delta variant is more contagious, we believe, than the B117, the last one that kind of swept through our community. That last big wave was more than likely, I think it's pretty certain, that was driven by the B117 variant taking off. So the Delta variant is more contagious even than that. And there is some impact on the severity of illness, as well as potentially vaccine, although overall, all of the vaccines are still effective. We've just getting some reports, some variability in the effectiveness of the mRNA vaccine. I'm still waiting to hear about the J&J vaccine. That's not as clear to me. Somebody out there, thank you if you're listening, put that question in, like, hey, what about the J&J? I don't have numbers yet, but I would probably venture to say that it's potentially that the vaccine may be slightly less effective, but still effective enough to bestow significant benefit on an individual or a community. And if that's not the case, we'll be letting you know. So that's the deal with deltas.
Doc, 1 second. Pat mentioned that I'm a lot louder than you are today, so Elise is working on the sound. So sorry about
Okay,
that.
sorry about that. And I have a new headphone too, so hopefully you can hear me. Okay, go ahead, Jen.
Oh, okay. Somebody had asked, why don't we ever talk about the risk of the vaccine when it comes to youth, for example, getting vaccinated?
Because the risk to youth appears to be very similar to the risk of every other age group. That's one of the reasons why they approved it for youth. It was not riskier, and the benefit was the same. So the vaccine can still cause, that body aches and fevers and all the things that we talk about with adults. The most common problem with adolescents, and this is true for all vaccines, is syncope, which is a fancy word for fainting. Um, Young people have lower blood pressures, and they can go down after a shot of any kind. So this is a problem we notice with all adolescents and young people, mostly adolescents, not the little ones, but the older children. They have more difficulty with feeling lightheaded immediately following a vaccine. But that is not really a true vaccine adverse event. It's an event, but it's not. It's caused by all vaccines. And then we have the newer issue of the myocarditis, which seems to be related directly to the mRNA. It is a rare event where the cardiac muscle can get inflamed, and it does appear to be occurring somewhat more often after the mRNA vaccine, although extremely rare. I think last I heard was like less than one, an increase about 1 in 50,000. But regardless of that risk, the risk of getting myocarditis from COVID is really high. And in some reports, like really like more than 1 to 2 per 1,000. So we always have to look at risk of vaccine versus the relative risk to other things. And it's not that we don't specifically talk about risk. I think we've talked about risk a lot, but it does not appear to vary significantly from younger individuals to older.
Okay. Somebody also asked, why don't you include the number of hospitalizations and deaths from the vaccine in the data that you post?
Yeah, because we're not aware of any hospitalizations or deaths from vaccine in our youth, actually, in any of our population, to be honest with you, all age groups. I can tell you, though, that we looked this up. We've had 10 hospitalizations in the 0 to 17 age group from COVID infection since the pandemic began. And we have had statewide 656 young individuals hospitalized from COVID infection, and we've had 13 deaths from COVID infection. So, again, the relative risk of getting COVID, even now, far exceeds any risk that you would take on getting vaccinated. And I'm assuming these questions are coming from concerns about, side effects from the vaccine. And I'll go back to say that we are not hiding anything. We're not misleading people. The surveillance, the post vaccination surveillance, is public information. We have 5 different systems that are doing surveillance of vaccine and vaccine adverse events. These are non governmental entities that do this surveillance. And the information that's coming back is extremely reassuring. These are good vaccines, they are safe vaccines, and they're very effective.
Okay. Pat asked, are less people getting tested now and have vaccinations slowed to a trickle?
Yes, and yes. So, like anything else, human nature, people are going to get tested when it's on their radar. Of course, it's summer, and summer is not a high time for viral infection. We get some allergies, etc., but this isn't a real big viral season. Usually, that's spring and fall. But testing is down. What did we say it was? I meant 127 tests per day, and I think at our peak were we not closer to 700 or 800 tests per day? So it really has slowed down. And of course, the what's the other part? Oh, vaccinations. Um, how much per week are we going up? We had about 400 first dose vaccines last week from all sources. A lot of people are going to pharmacies, great place to get your vaccine. Um, yeah, but really, when we do set up vaccine clinics, we're happy to see 10, 20 people. So that I think that interest in vaccines hopefully will grow as people learn more about them and as the variations of this virus continue to taunt us and threaten us.
The next question was from Jennifer. She asked, do we test for the COVID variant?
Not consistently, not on every sample. The state has a sampling mechanism where they test specimens that get sent to them through commercial labs. We do send our specimens for testing. So if you've done it through us, chances are it'll get sent. Right now, the state lab is able to process every single one. But I brought this up before. The sampling for variants, the genetic sequencing, is done. It's a very labor intensive process that takes, I think, upwards of several days. I had heard it a week, but it takes a long time to get those results back. And the state's been very clear that the amount, so in order to take a sample and apply it to the entire population, you need to have a couple things. The sample has to be large enough, and the sample has to be randomized so that you're not collecting it from very specific populations that could skew or bias the outcome. And so far, variants are not done in that way. So regardless of how many variants we are reported in our community, it's not possible to say that's the percentage of variants in our community. All we can really say from that is they're here. And so for now, until that surveillance process is worked out, all we'll be able to say is the variant's here. We won't be able to say how much of it's here, unless we
Doc,
spike like the last time, and then we know. I'm sorry. Go ahead.
besides Pat, Jerry
Yeah.
had said it sounded like something was going on with your microphone and your headset. So people are having a hard time hearing you, but I know that you're plugged in, so I'm not sure what's going on, but hopefully I
I'm
can hear you
sorry.
just fine.
Do you want me to
Hopefully,
unplug my? Let's try this.
okay.
Can you hear me now?
I still
Is
can,
the
but I'm not
microphone?
sure.
Well, let's try this. This is
Okay.
the microphone on the computer. I have a new computer and a new headset all happening since last time, so I apologize. We'll get that fixed by next time.
Okay.
Let me know,
Ale-
any of you guys listening, let me know if this sounds better.
Elise said much better on her end, but okay, we'll
Oh,
see what happens.
good. All right.
Okay.
We gotta talk to Luke about this. He got this for me. So.
Next question from Marilyn. With the new variant, why are we not still requiring masks? I wear mine still, just overly cautious.
No, you're not overly cautious. I think those of you who are still comfortable and inclined to wear masks are quite honestly are wise. I am wearing my mask as well anytime I'm going indoors to a place particularly that I'm not familiar with. World Health Organization has come out and officially suggested that people do in fact recommend people do in fact wear masks. Mask wearing, as you know, has turned into a little hot button item politically and ideologically. And I think there had to be, I think, some compromise with epidemic orders and what the state health department is ordering people to do. But for those of you who are immunocompromised, those of you who, for whatever reason, haven't been vaccinated, those of you who have been vaccinated and you're still concerned about bringing home the virus to your loved ones, wearing a mask is still very prudent and still very wise. There's absolutely no harm that can come of it, and there's a great deal of benefit. So that's what I'm going to say, and that's what I'm going to continue to say, unless we get backed into a corner again and we have to tell everybody, put your mask back on. But for now, masks are optional, but strongly recommended, especially if you're unvaccinated, if you've been vaccinated and still have concerns.
People are commenting much better sound now.
Oh,
So
good,
you know.
good.
Okay, Melody asks, can children who are at the height and weight of a 12-year-old get the vaccine? I know they are testing the right dose for smaller bodies, but what about an 11-year-old who meets the 12-year-old criteria?
No, it's based on age, and that's just because that's the studies have been based on age. I understand where you're coming from because medications are often dosed based on height and weight because of absorption, et cetera. But vaccines are a whole different animal. Vaccines are not really they're treatment, but they're preventive treatment, and they're things that go in our bodies to stimulate our immune system. And so those studies are done based on generally populations based on age. And so the age criteria is pretty strict. It would be based on your birth date, not on your development.
Okay. We do not have any more questions. So we normally will try to go to 4 o'clock, but I guess I just wanted to mention too, we talk a lot. Once a month, we'll do this on the first Thursday of the month.
Mm-hmm. Mm-hmm.
Do a COVID update, but also we are open to doing other hot public health topics too, such as mentioning the
Absolutely.
behavioral risk factor
Mm-hmm.
survey and other issues. So we'll talk about other things as well, and you guys can always ask questions regarding
I was going to
things that
say,
you
please,
want to
you can
know.
always send your questions in, and we'd be happy to respond to you one-on-one. There are topics that seem to rise to the surface, and everybody is curious about them. I think just tuning in once a month is we'll be here. I should do it. So I should
Go
just
ahead.
do a little blanket thing here. So my other comment, and it kind of goes back to the comments about wearing a mask. Please continue to be cautious. Watch our website. Watch the numbers. We will notify the community if we're seeing alarming trends or moving in the wrong direction. And the science hasn't changed, whether this is a variant or a non-variant or a high-risk variant or a variant of concern. The science, the pathology of this virus hasn't changed. It is transmitted through respiratory particles over fairly close distance, 3 to 6 feet, right? 6 feet over 15 minutes. So social distancing and masking, good hand washing, all those things can definitely help you stay out of trouble. So please don't let your guard down, and we'll be in touch. That's it.